Hi, my name is Elisa Chauca and I'm studying in the University Santiago de Guayaquil. My topic is female genital schistosomiasis and my tutor is Mr. John Moscoso. Definition: clinically apparent vulval, vaginal, and cervical schistosomiasis is a common gynecological finding in areas where infection with schistosomiasis microbiome prevails. However, as a disease entity, female genital schistosomiasis (FGS) has been neglected during a period when considerable progress has been achieved in almost any other field of schistosomiasis research. And the video. Applications in nursing. Schistosomiasis control is based on large-scale treatment of population groups at risk, access to safe water, improved sanitation, hygiene education, and control of snakes. Pre-sequential is the recommended treatment against all forms of schistosomiasis. It is effective, safe, and inexpensive, although there may be reinfection after treatment. The risk of serious disease decreases and even reverses when treatment is started and repeated in childhood. And the video. Pros and cons. Pros. Genital manifestations of S. mansoni infections have been neglected as a disease entity during a period when considerable progress has been achieved in the diagnosis and management of other disease complications such as liver fibrosis. Cons. One of the main limitations of schistosomiasis control is the low availability of pre-sequential and the video.
I have worked for many years on schistosomiasis, and it's a relatively recent phenomenon that we've realized just how much the female genital system has been involved as a result of adolescent and even younger girls getting infected with urogenital schistosomiasis, schistosoma hematobium, and as that infection has proceeded over the years, eggs from the worms that have supposedly left the human body in the urine, having gone through the bladder, have actually ended up in the cervix. Now the result of that is that eggs in the cervix have resulted in lesions. Now HIV has to get inside the human body, and these lesions on the cervix act as an open door. Adolescent girls in many parts of Africa, unfortunately and sadly, have their first sexual experience with older men, and many of those older men may be infected with HIV. In a number of different countries, specifically Malawi, Tanzania, and Mozambique in particular, where the prevalence of schistosoma hematobium is much higher than expected and than usual, so too is the prevalence of HIV in young ladies. And therefore, the assumption is that there is that link which I have described.
For me, schistosomiasis is not only a parasitic disease. It starts with a parasite, but then it develops into chronic morbidities. One consequence is female genital schistosomiasis. It's, in my opinion, completely underestimated. It results in a gynecological disease. It's definitely women suffering from FTS are at very high risk to get HIV. Most women are not even aware that they have female genital schisto. They suffer from symptoms they don't want to talk about. Yeah? They suffer from bleeding, even from infertility. It's stigmatized, and you are not going to see a doctor and explain what's happening. Plus then you have the fact that you have areas where you have 5 times higher HIV incidence, where you have hematobium infections. So for most of us it's very clear what's going on, but absolutely how to explain to women that there's HIV as a high risk when you even do not know that we are talking about schistosomiasis.
We have to be proactive. Those girls often don't know they're infected. They're almost certainly in the rural poor populations, and therefore they don't have access to medicines. They certainly don't have the money to purchase them. But we, using donated praziquantel, can reach out to those children, initially at school, but also what's more important is the girls who are not at school, because of all the population group that have the lowest attendance at school, it's 8, 9 and 10-year-old girls. And so we've got to go out into the population, we've got to be proactive.
It's not understood so far by the HIV community. They have very ambitious goals to have 0 new infections by 2030. But you can only achieve it if you understand all your factors that are contributing. And for me, FGS is an important factor that is not well known in the HIV community. Don't see us as the parasitologists on the other side of the fence. Include us, yeah. When we discuss FGS with the Schisto community, there's always agreement. You know, everybody understands what we are talking about. Invite us into a dialogue, and it started. So I'm not saying it's not happening. It started. It's slow, but we need to get there.
We have 10 million girls who would qualify for treatment, and Peter Hotez, who is the editor of PLOS NTDs, has on a number of occasions, and I've actually co-authored with him, published papers saying that we actually could make a stab at prevention of HIV for only the cost of treatment with praziquantel. For 30 pence, we can provide young girls with a treatment for schistosomiasis before any lesions have developed. And the assumption is, and I think it's a very fair assumption, that we'll close the door to HIV infection when they have their sexual experiences.
Issue applied in Ecuador. In impractical throughout the natural evolution of AIDS-induced lesions is almost unknown. In patients whose records have been published, the natural story has been interrupted by surgical intervention, which in the case of imperceptibly sized pelvic tumors of putative malignant origin seems to be justified. However, whether in young women with cervical schistosomiasis, hysterectomy is appropriate therapeutic means. In conclusion, that migrating wards are actually responsible for the deposition of eggs in ectopic organs rather than a mere embolization of possibly transported eggs to aberrant sites is clearly evidenced by the identification of copulating adult worms in histological sections of internal genital organs. And the video.
El servicio de infecciosas del Hospital Vallebrón tiene una colaboración ya hace unos 10 años con un hospital de Angola, y en esta colaboración pues ha habido bastante trabajo clínico, pero en los últimos años pues también estudios de investigación. Nosotros, a partir del trabajo clínico allí, vemos que había muchos casos de esquistosomiasis en niños, pero no sabíamos exactamente la prevalencia de esta enfermedad en la población. Por eso se decidió hacer este estudio en el que se estudiaban los niños en edad escolar. Se fue a los colegios a hacer el estudio, por tanto eran niños sanos que no habían acudido al hospital para nada, y se vio que tenían una prevalencia de esquistosomiasis de más del 60%. Este hallazgo pues, es muy impactante y implica muchas medidas a tomar en el futuro, sobre todo a nivel de salud pública. Y bueno, la Organización Mundial de la Salud recomienda que en prevalencias tan altas se debería dar tratamiento preventivo en las escuelas a todos los niños. Esto ha entrado en el Plan Nacional por primera vez el año pasado en esta zona a raíz de este estudio. y bueno, esperemos que esto lleve a otras actividades que también hay que hacer, como tratamiento de las aguas, etc. Por nuestra parte ha llevado a otros estudios de investigación, estudios ecográficos para poder ver las lesiones que presentan estos niños que tienen una media de edad de 10 años, son niños bastante pequeños, y otros estudios en otros grupos de edad. Ahora, pues bueno, se postula mucho que el tratamiento debería empezarse a una edad más temprana, incluso niños menores de 6 años, y este es el estudio que ahora queremos empezar para poder ver la prevalencia en este grupo de edad y también el daño estructural que ya tienen niños mucho más pequeños.